The GLP-1 medicines are amazing, but they do have side effects. So today I want to go over the top 5 side effects of GLP-1 receptor agonists and what to do about them. I'm Dr. Spencer Nadolsky, a triple board certified obesity specialist physician, and I've overseen thousands of patients myself and overseen tens of thousands if you include the doctors that have been under me at the various programs I've worked at. I'm going to go over the side effects in terms of what the trials see and what also we see in clinical practice and what we do about them. Number 1, by far the most common side effect you're going to see is nausea. If you've taken one of these medicines, you've probably had at least a mild to moderate amount of nausea. Some people don't have any nausea, which is lucky for them, while some people, unfortunately, are unlucky and have a moderate to severe amount of nausea with some vomiting involved. When you look at the trial data, though, most of the nausea is at the beginning of the trial. It spikes up, and then over time, it starts to subside, and this is what we see in clinical practice. Most of the time, once people are to their maintenance dose, they have mild to no nausea at all. The goal is to prevent the nausea in the first place. Luckily, I have a team of amazing dietitians who help my patients through dietary means to help minimize and avoid nausea in the first place. Me as the medical doctor, I want to make sure I only titrate up the medicine once the nausea is mostly resolved. It doesn't have to be completely resolved. Sometimes that takes a lot longer, but ideally, you're not going up in your dose of the medicine until you're like around a 2 out of 5 of nausea severity. For example, if you're on 0.25 milligrams of Wegovy and you're feeling like you're gonna throw up, and the next month you ask your doctor for a refill and the doctor tries to put you up to 0.5 milligrams, I would probably hold off on that. Same thing with Tirzepatide. Say you're on 2.5 milligrams and you're feeling a lot of nausea, I would make sure that you're not going up to that 5 milligrams unless that nausea is very mild. To help prevent the nausea in the first place from a nutritional standpoint, the biggest things are very heavy, fatty foods. So some of this stuff is pretty common sense when you're trying to lose weight, but think of things like pizza, wings, chips, french fries, burgers, those types of things. Very heavy, very fatty meals. A lot of times patients learn this because they ate one of these fatty meals in the beginning and they felt terrible the next day. This doesn't mean you can't enjoy those foods once in a while later on in your journey, and you can even try to enjoy them early on, but just know that if you try to eat a high fat meal like pizza, chips, wings, whatever, you may feel pretty terrible the next day. You may even feel it within hours of eating that food. The mechanism of the nausea is kind of interesting. Most people think of it as the slowing of your gastric emptying that may be related. However, there's actually areas in the brain that relate to where the medicines hit for satiety and help you not eat so much and help with the food noise and all that. And then there's other areas of the brain that actually are related to the nausea. And fun tidbit, researchers and scientists right now are trying to make a more targeted GLP-1 receptor agonist that only hits those parts of the brain that help with satiety and food noise while not hitting those parts of the brain that cause nausea. We'll see if they make any progress there. It might be a long time before they get there. Another dietary tip is that if you're eating already a lower fat type of diet and you're like, gosh, I'm still feeling nauseous, sometimes breaking up those larger meals and making them a little bit smaller. So instead of 3 larger meals per day, it might be 4 to 5 or even 6 smaller meals per day. Again, I'm lucky that I have dietitians who will work with the patient on an individual basis and strategize with them in their own life. The other thing I do from a medical standpoint is if they're on, let's say, Wegovy, semaglutide, and they're having a lot of nausea despite all the dietary efforts that we put in to help minimize that nausea, sometimes I will switch them to Tirzepatide or Zepbound. The GIP components, a GLP-1/GIP co-receptor agonist, that GIP component actually works up in the brain and has anti-emetic properties, which is kind of interesting, whereas the GLP-1 receptor agonist only in semaglutide doesn't have that property. Patients tend to tolerate that Tirzepatide much better, so we'll switch them over if insurance allows for it, or if they want to pay out of pocket if insurance doesn't cover it. And lastly, I try to avoid this, but I will do it for my patients if I need to. I can use anti-nausea medicines. My go-to is Zofran or ondansetron. I use the oral dissolving tablet on the tongue. Some people like to do the swallow tablet. It's up to them. Once in a while, Zofran doesn't work or the ondansetron doesn't work. And once in a while, I do use Reglan or metoclopramide. This is a motility drug, and sometimes this helps a little bit better than the Zofran. I try not to do that very often. It's only in refractory cases where the Zofran's not really helping. Make sure you talk to your doctor before you take any of these types of drugs or even think about it. Obviously, they need to prescribe it, but don't be taking your friend's drugs. Okay, second most common thing we see, constipation. Now, instead of nausea, where it's a spike in the beginning and then starts lessening throughout your GLP-1 receptor agonist journey, constipation tends to be constant. So in order to prevent this in the first place, we're going to do some dietary strategies. Again, lucky I have amazing dietitians who help with this. We have resources to make sure we prevent this in our patients in the first place. But here are my general tips. Number one, of course, you're going to want to drink a lot of fluids. You know, some people just completely forget to eat and then they don't even drink fluid. So make sure you're staying hydrated. You don't have to hit some number of cups per day of water. Everybody always says, drink 8 cups of water per day, but like honestly, just try to keep your urine a very light yellow to clear. Number 2, try to eat whole food, fibrous types of foods. Don't avoid carbohydrates because you think they're gonna cause you to gain weight. They're not going to beyond their calorie content. They contain fiber unless you're eating highly processed carbohydrate containing foods. So try to eat whole, unprocessed types of carbohydrate containing foods, lentils, beans, fruits, vegetables, those types of things. Again, this stuff is common sense. Obviously, if you're trying to lose weight, those things are good for you anyway, but try to focus on these types of foods to avoid the constipation from happening in the first place. The other thing I do is obviously for weight loss purposes, we want to keep people moving, but physical activity with the fluid and high fibrous foods can help keeping your bowels moving. The next thing we do is supplement with fiber if we need to, if we feel like they can't get enough in their diet. We start with psyllium husk, although too much psyllium husk can make the constipation worse in some individuals. So we want to make sure we're talking to the patient, asking them what their stools are like and their bowel movements. We may need to switch the fiber supplementation, switch it to some other type of fiber. Then lastly, we may actually start looking at laxatives for helping them move their bowels. My general go-to for the laxatives is Miralax or polyethylene glycol. Really easy to add to whatever kind of drinks, flavored drinks that you want. It goes down pretty easily, just a serving today. Again, you want to talk to your provider, make sure that it's not interfering with anything like that before going to that route. But Miralax or polyethylene glycol is one thing that I do. Magnesium citrate's another one that you can look into as well. Again, if you have a dietitian and a good doctor, make sure you talk through some of these things. The third thing we see a lot of is reflux. So because the medicines slow down your gastric emptying, the food contents can stay in your stomach longer, which then give it more of a chance to reflux up into your esophagus. And then you start feeling that reflux. The same thing for reflux is like for the constipation and nausea, where dietary and lifestyle modifications can help a lot. This is where I love my dietitians again, of course. However, easy things like making sure we're sitting up after meals. Sometimes we have to lower the bulk in our meals, smaller meals if we need to do that, so that the food goes down a little bit faster or there's less bulk sitting in your stomach. Modifying the types of foods may be able to help there. Again, this is where working with a dietitian and really strategizing your dietary pattern and seeing what triggers are causing your reflux. Lastly, again, I try not to have to do this, but sometimes you have to start with things like Tums, then you go to what's called an H2 type of blocker over the counter, like a Pepcid, and then sometimes you do have to go to like a proton pump inhibitor, like a Prilosec or a Meprazole as the generic term. Again, ideally, we wouldn't have to do these. We would use dietary modifications because we don't want to have to add medicines on to counteract a side effect from another medicine, but sometimes you have to do what you have to do if the benefits outweigh the risks. Always talk to your doctor before starting any over-the-counter medicines, regardless if they're supplements or medicines. The fourth thing we see is once in a while, people start developing diarrhea, which kind of goes against the idea of gastric slowing, because we see with the constipation, you know, it makes sense if things are slowing down, things aren't moving through your bowels as quickly, but with diarrhea, things are moving very quickly. The diarrhea tends to be self-limited. Lucky again, my dietitians do help strategize because there are certain foods that may be able to help with this, and certain foods may trigger it, such as the fatty foods or something else. And sometimes you actually need to bulk up your diet and make sure you're getting more fiber so that you're forming an actual stool. When that doesn't help, and of course in that acute situation when people are miserable having diarrhea and they need to go to work or they're traveling or whatever else, tend to move towards Pepto-Bismol first. And if that doesn't help, I do go with Imodium. Again, always talk with your doctor about dosing before you start using any of these over-the-counter medicines and supplements. Lastly, one of the common side effects that people don't talk about enough stuff is fatigue. Now, a lot of people will say it's just because you're not eating enough, and potentially that could happen. But what we're seeing is sometimes people aren't even getting an appetite effect, and they're not eating fewer calories, they're not losing weight, but they're feeling tired, especially a couple days after their shot. No one knows the exact mechanism of this. Some people hypothesize it's all from that kind of Zepbound maz or blaz that I was talking about, kind of that downregulation in your reward center, which has to do with your dopamine. So the fatigue you're feeling is really just kind of a lack of a motivation. Other neurobiologists I've talked to said maybe the medicine hits in certain places of the brain that are similar to like chemotherapy or other drugs that cause fatigue. That's kind of a side effect. A lot of people will say, go start supplementing with B12, go get B12 shots, go get NAD shots. There's not really a reason to supplement with B12 though, unless you are deficient. And especially in the beginning when people feel fatigue right away just from the shot, it's likely not B12 deficiency. Over time, actually, you could potentially develop a B12 deficiency just by not eating enough or changing your dietary patterns. So obviously supplementing and testing when needed, when indicated, is a good idea. However, if you're feeling fatigue right off the bat from taking the shot, not likely a B12 deficiency. Right now, there's no evidence to say that an NAD shot or anything like that is going to help out right now. Maybe there'll be some trials in the future, but as of right now, I wouldn't recommend that. What I do see is that sometimes it just takes time to get over this fatigue. Some of my patients who didn't lose weight and were getting fatigue in the beginning, clearly it wasn't a lack of calories or anything like that. Over time, that fatigue started to minimize and resolve. Other patients, no matter what, through their journey, they feel about a day or two after their shot, this post-fatigue shot that they talk about. In these instances, because the benefits outweigh the risk, let's say they lost a ton of weight and they want to make sure they keep off the weight and they want to continue the medicine, instead of coming off the medicine, they just time when they take the shot and know that one of the days, either a day or two after, they're going to feel a little bit tired. Lastly, again, I hate to do this and add on more medicines, but sometimes I add in a little bit of Wellbutrin or bupropion to help with that. I do that more when patients are having a constant anhedonia, that whole meh, blah, lack of motivation type of thing. We lower the dose, ideally, let's say their Tirzepatide or their semaglutide, Wegovy, and Zepbound. And if that doesn't do the trick, sometimes I have to add in another medicine, but ideally we would avoid that by adjusting the dose for them. So there you have it. There are my top 5 side effects and what we do in our clinic and what we see in the trials in terms of side effects for these GLP-1 receptor agonists. Hope this helps. Make sure you share this with a friend who might be having some side effects. Make sure you subscribe to my channel as well for more tips and tricks on losing weight, obesity, and these GLP-1 medicines.